Hello and welcome back to another video. In this video, I'll be sharing with you natural ways to lower your blood pressure. Now, high blood pressure is very, very common, and you may be one of those people that doesn't like taking medications. Well, not to worry, I got you. I have some natural solutions that can help you to lower your blood pressure. Okay. Now, I will say that in my practice, when I was doing primary care many years ago, I would teach my patients these tips and information. I'd give them a handout or whatnot because a lot of people don't like taking medications. And so I would give them the information and say, you can do this, you can do this. And they will come back and their blood pressure was lower and we were able to cut back on their blood pressure medications. And it felt really, really good to be able to help people in that way. So I'm so excited to share this information with you here on YouTube, even though you're not seeing me in the clinic. So number one is regular exercise. Now, you may be somebody that doesn't like exercise, but not to worry. All you need to do is just find an exercise that you like, that you enjoy, maybe make it social, make it a fun thing, and get regular exercise in. Now, the guidelines, they recommend at least 150 minutes of exercise every week. That's moderately strenuous exercise. And they also recommend strength training about twice a week. Now, some is better than none, right? So if you're a busy professional and you're having a hard time getting that in, I would say maybe start with what you can get in. Is it 20 minutes? Is it 30 minutes? And schedule that 2 or 3 days a week, whatever your schedule allows and what you're able to commit to. And try finding a community, maybe someone else to walk with or to work out with or to go to the gym with. That'll make it easier for you to kind of stick to your exercise habit. So exercising regularly and keep a journal, like write down when you exercise. I find that very helpful. I have an Apple Watch. So that does track when I do a workout. I record it on there, but I also have my planner that I have right here by my desk, and I write when I worked out and for how long I worked out for. And it doesn't have to be anything super complicated, right? You don't have to go to the gym. I don't go to the gym. I prefer to be outside. So I would either ride my bike or I would go for a walk or a little jog, right? That's it. So regular exercise, okay? Right. Second thing is your diet. Ooh, diet is so important. Eating more fruits and vegetables, whole grains, and potassium. So your fruits and vegetables are the foods that's going to have your potassium, which helps to lower your blood pressure. So whatever you do, make sure that when you're preparing your plate, putting your meal together, you're getting in those vegetables so that you can get your potassium. Now, let me show you some foods that are high in potassium in case you're kind of wondering, well, what foods are rich in potassium? So you have your white beans, white potatoes, avocados, sweet potatoes, greens like spinach, bananas, dried apricots, and oranges are pretty high sources of potassium. Salmon is also a high source of potassium. So I know people often think about bananas, and a lot of people know that bananas are high in potassium, but these other foods are also high in potassium. So keep that in mind. Try and get more plant-based foods into your day, fruits and vegetables, and that'll help you overall health and help lower your blood pressure as well. Okay, so diet, super important. Diet, exercise. And the third thing is reducing your sodium. So different guidelines will suggest less than 2,300 milligrams of sodium a day. But if you also have a history of heart disease, kidney disease, they'll say less than 1,500 milligrams of sodium. Easy to remember, just say less than 2 grams of sodium. Of course, discuss this with your doctor, but basically reducing your sodium overall is helpful. So what's a practical way to do that? Number one, don't eat those frozen dinners, those canned soups, because those are very high in sodium. When you're cooking, don't put salt in the food as you're cooking it. Instead, put it in towards the end, or don't put salt in it at all and just put like a pinch of salt on your plate. You'll find that you'll use a lot less salt when you cook that way. And always read the nutrition facts on every single thing that you buy. I always look at the back of them and make sure that I'm not picking things that have like, if you see some frozen dinners, they tend to have like 50% of the daily value of sodium. That's too much. Or even like 40% if one meal is just too much. So I wouldn't buy something like that. The same thing with the soup. If you're going to buy a canned soup, buy the one that says low sodium or no sodium. And the same thing for beans. If you buy the canned beans, buy the one that doesn't have added sodium. So anytime you're buying something that could have sodium in it, look for the option that has no sodium or low sodium. And another way to control how much sodium you're eating is to limit how often you're eating out. typically the food at the restaurant is packed with sodium, and it may be hard to even get your hands on the nutrition facts for what you're eating. And trust me, if you look at them, you may not want to eat there because you'll see how much fat, saturated fat, and sodium it has. You'll be like, oh my goodness, this is unhealthy. So limit your eating out. Eating out every day, that's a sure, fast way to get too much sodium and too much unhealthy food, okay? So limiting how much you're going out to eat is a nice way to reduce the sodium that you have in your diet. Cooking your food at home, and like I mentioned, not putting salt in it while you're cooking, or just putting the salt in a little bit towards the end. All right, so the next tip to reduce your blood pressure naturally is, of course, quitting smoking. Now, if you're on this channel, you probably don't smoke already. Anyway, you're probably a super healthy person. But for those of you that are struggling with smoking, quitting smoking will lower your blood pressure. And there are programs that can help you with quitting smoking. There's even medications that can be used. There's a patch, nicotine patch, that can be used to help you to quit smoking, but that's going to be super important as far as lowering your blood pressure, all right? Now, the next thing is limiting alcohol. Limiting alcohol, reducing alcohol will help lower your blood pressure. So definitely highly recommend that, okay? And the next tip is sleep. Getting a good night's sleep. 7 to 8 hours is what the guidelines recommend. Also helps to lower your blood pressure. Yes, it truly does. So getting into a nighttime routine, having a restful sleep, waking up feeling refreshed in the morning helps to lower your blood pressure as well. So lowering your blood pressure is not just one activity. It's a holistic plan that you must incorporate into your life to help lower your blood pressure. It's not just one thing, one activity, but a collection of activities, right? And so that's one thing that I want to kind of leave with you. Sometimes people think that, oh, if I take this one pill or I do this one thing, this will lower my blood pressure. Or if I do this one thing, this will help me to lose weight. No, it's not about just doing one thing. It's about the collection of activities that you're doing that range from what you're eating, your sleep, your stress levels, your environment, your mind. Like everything is important in this holistic lifestyle. Okay. All right. So the next tip is reducing your stress. Reducing your stress. Oh my goodness. Who else feels stressed right now? We just came through a pandemic where we all felt stressed. And stress, chronic stress significantly increases your blood pressure. So you want to make sure that you're managing stress, that you're engaging in stress reduction technique every single day to lower your blood pressure. And I have another video on stress reduction technique, and make sure you take a look at that. And I found that incorporating those into my everyday life, 15, 30 minutes a day of meditating, mindfulness, journaling, significantly reduces my stress, lower my blood pressure, and it is just completely transformative. So stress, have to find ways to manage stress, deal with it so that the stress doesn't control you and so that you're able to feel more peace and less stressed out. Okay. And the last tip, of course, is to make sure you're checking your blood pressure regularly. I cannot tell you how often I see patients in the hospital or the clinic who have not seen a doctor in many years. They're in their 50s and 60s or even their 40s. They don't check their blood pressure at home and they notice either palpitations, ringing in their ear, or headache, or blurry vision problems that led them to go to the eye doctor, and the eye doctor diagnosed them as having high blood pressure, and then they were either sent to the ER from there. So it's really important to get your blood pressure checked on a regular basis. That way you can kind of tell whether it's going up, whether it's normal, what's normal for you. And of course, you want to make sure you're seeing your primary doctor every year for a physical, especially if you have insurance. You have the benefit, you have insurance, use it. So many people don't use their insurance benefits for whatever reason, but at least every year you should be getting blood work done and seeing your primary doctor, getting your vitals checked and your blood pressure. Now, of course, you should be getting your blood pressure checked multiple times during the year. You can buy a blood pressure cuff from the pharmacy for like $30, $40, or you can even go to some pharmacies. Some of them have a blood pressure machine there where you can check it. So just make sure it's not years before you get your blood pressure checked, because by then the damage potentially could have already been done, to your internal organs and your vasculature, when you could have prevented that by just simply keeping a close eye on your blood pressure regularly, because prevention is always better than trying to find the cure. So as you know, I am a internal medicine, lifestyle medicine doctor, and I'm big on prevention. I really want people to realize that you have more power than you ever know to control your health, to lower your blood pressure, to improve your situation. And you don't always have to take medications. Medications are not the answer for everything. Medications, of course, are necessary. However, in many cases, specifically let's talk about just the blood pressure issue, blood pressure medications lower the blood pressure, but it doesn't get to the root cause of why is your blood pressure high? Is your blood pressure high because you're stressed out? Is your blood pressure high because you have excess weight, or you're retaining water, or there's something wrong with your kidneys? You see what I'm saying? So blood pressure medications will lower your blood pressure, but it doesn't treat the underlying problem. That's why it's important to have a holistic approach to health, where you're not just giving prescriptions to lower blood pressure, alleviate symptoms, but you're actually getting to the root cause of the underlying pathophysiology. That is super, super important. And then also, last thing that I have to put in there, because I know that this will be of a concern, and I noticed this quite often when I was doing primary care. Men, elevated, uncontrolled blood pressure, if left unchecked, can cause problems with your arteries, your blood vessels throughout your body, but particularly the blood vessels that go to penis, and it can cause erectile dysfunction. So if you're a man and you're listening, or you're a woman and you have a man in your life, if nothing else is a motivation for him to go see his doctor, let that be a motivation. That high blood pressure puts a strain on your heart and can lead to cardiovascular problems. It can lead to vascular disease. And often one of the first signs of cardiovascular disease in men is erectile dysfunction. Before you start to have chest pain, before you're diagnosed with heart disease, what we notice will be that you'll end up coming into the primary care doctor's office with problems maintaining an erection. So keep that in mind. Let's keep that blood pressure on the check, right? Go to your primary doctor. Make sure you're exercising, eating lots of fruits and vegetables to get the potassium in, lowering your sodium, stay away from the alcohol and the smoking, and get some physical activity and exercise in the week, right? And you'll be good, right? Because we want to cultivate healthy habits so that our communities can be healthier, so that we can live long, so that we can thrive, so that we can do whatever it is that God has put us on this earth to do. And trust me, if you are tired, fatigued, you got a headache, you're spending money on prescriptions, hospital bills, doctor visits, like every other month, that's less money that you could be using for other things. So that's why I share this information here, because this has consequences that are long lasting. Having uncontrolled health conditions that are not managed has long lasting health conditions, not just for us physically in the present on this earth, but I think it also has spiritual consequences as well, because we're not able to, if we're unhealthy, we're not going to be able to live out our purpose in this life, be as effective as God would want us to be with whatever it is that He has commissioned us to do on this earth. All right, so that is all for this video, and be sure to subscribe to the channel. We'll have the links below for my website. I would love for you to subscribe and join my newsletter. I email my list a couple of times a month with information different than what I post here on YouTube. And then also my email list is the first to know when exciting events are happening, when I'm speaking places, or when I'm having the next online course or program launch. So be sure to check out my website, and I will see you in the next video. Stay well.